Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Hello again, this is Dr. Lewerenz at Deep Six podcast. I appreciate you joining us here again. And I'm directly coming from you from Longevity Health Institute in southeastern Michigan, but we have many locations and service actually people all over the country in our concierge practice and are using our 6-point model and really diving deep into your health and doing just real good preventative stuff. And actually, and what I'm key about too is building a great culture, a great community around us, and really excited about that because that's really making an impact. When I'm gone, I want there to be an imprint that you guys can say, hey man, Longevity Health Institute made a big difference in my life. So this is the episode, the AMA. So this is, I think, our third AMA, and AMA means ask me anything. Now, these are things that actually you haven't sent to me, but I took some notes because patients have asked me in the room, and they're basically questions I get asked often, and they're unique ones. So I want to share these with you because they might resonate with you. Again, if you're learning something here too, please subscribe, share with others. The more subscribers we have, the better guests I get. Just had actually a guest on recently from Bush, the rock band Bush. And thank you again, Nick Hughes, for joining us. And I saw them on the road recently and helped out the band when they were at the end of their tour under weather. And but yeah, the more we have listening and enjoying, hopefully, the better guests we'll get. So I appreciate that. And thank you for sharing this good message with others. So listen, here's my first one. And this one's going to resonate with 1 in 4 people out there. So when I say this, how common this is, okay, 1 in 4 people have this condition. And it's still, to this day, after decades, misunderstood. And that is herpes, HSV 1 and 2. So herpes simplex 1 and 2. And why I'm bringing it up, that's correct. You did hear me right. 1 in 4 people in America have herpes. And it is so prevalent and often underappreciated what it is. And why I want to talk to you about this, because yes, it might not sound really life and death. And obviously, if you're unfortunately, have this virus, which is very common and can show very minimal symptoms to very major symptoms, whether it's a lesion on your lip or your genital area or even in another mucosal area. Often, by the way, commonly one-sided, meaning like one side of your lip, one side of your nose, genitally, etc. And it can be sexually transmitted, but just basically can be transmitted in contact, just so you know. But being so prevalent in the community, it's actually spread easily. And here's where I wanted to address is because it does create a immune suppressant hit, okay, and comes out when your immune system is stressed. And so what that means, and then what are common triggers? So it's very easy to call me or call one of our other practitioners and say, hey, can you give me some Valtrex? Can you give me a cyclovir? We use even oral silver and topical silver gels that help this resolve pretty easily. But here's a couple key things on people that have this recurrently. So have to take chronic suppressive therapy for herpes, and what it might mean. So what I mean is you talk to your doctor, talk to your provider, and get a better understanding of why this might be happening so much, because what it's telling you is one of two things. One is that you're under an immune insult. So meaning your immune system is not robust. It is not strong, and this virus keeps coming out. And there's a few reasons why this could be. One of the first things I always say is check your sleep. Make sure you're sleeping efficiently, deep enough, long enough. You're really addressing that component. You're not overstressed, at least long term. You're recovering enough. And when I say recovering enough, I mean you're not excessively training. So if you're working out hard and you are getting herpes outbreaks often, that's a sign that you're over-suppressing your immune system and your adrenal function, and this is why that virus is coming out, okay? And then often this is accompanied by the excess of arginine, an amino acid. So what's been found in science is the ratios of arginine and lysine are very critical when they get tipped, and there's more arginine in the diet, which is in proteins, which again, with exercise and trying to be health conscious in that, you might be consuming more proteins and then ultimately more arginine. When this balance gets tipped, you can actually bring out the virus. When the virus is out, now you're getting some neuroinflammation. It often accompanies fatigue, which sounds like kind of nothing, but what is it doing to your body? Now, research so far is not showing much long term other than when your immune system's down, what else is happening? Meaning, are there going to be other co-infections and things that flare up? Now, what I think we will find over time, just like we have with another virus, Cytomegalovirus, which I'm going to touch upon, and varicella virus, the shingles virus, is that we are seeing significant neuroinflammation. Is that causing some brain inflammation that could predispose us to some cognitive impairment and some, degradation of the brain down the line decades out? That literature is still, not out yet there's some suggestion of that. Okay. So what I mean is we're not innocent just getting herpes over and over and over. Okay. Now, what I often see in my practice and when I'm asked often is, why am I getting so many outbreaks? The arginine thing is really real. And when people focus on the protein in their diet and they're trying to eat more meat, et cetera, that's really common. Then it starts to come out. Ultraviolet light can do this. So if you're on vacations in the sun a lot too, okay. Stress, as I already mentioned. Another big one is red wine. Now, I say this because I'll often see upticks of herpes simplex virus. Again, one or two, either one, doesn't matter, in the fall or winter, because my patients will tend to lean towards red wines. I even personally love red wine in the fall and winter. It's kind of warming. But red wine typically has a lot more arginine in it. So again, that tip of the scale, that teeter-totter, you will probably need to preventatively be taking some lysine. Now, common questions are how much lysine? Well, that is kind of subjective. It may be anywhere from 2,000 milligrams to 4,000 or 5,000 milligrams to counteract it. But just so you know, triggers like arginine, red wine, excessive meats, sleep deprivation, excessive training, and stress is causing these to come out. Taking an antiviral, again, can suppress these, but you want to pump the brakes and check yourself so that you are not predisposing yourself to, some further condition down the road, meaning another infection, and or are we looking at decades out, some other insult, especially neurocognitively. And I do believe that literature is coming. Now, another virus, Cytomegalovirus, very key, because there is new literature on this, that Cytomegalovirus is causing some DNA damage. In fact, actually, it's accelerating your aging approximately 12 years, so more than a decade if you have Cytomegalovirus. Now, what does that mean? What it means is that you're getting, you're damaging telomerase, your telomeres, which are the DNA end caps at the end of your DNA that protect your DNA so that you can replicate your cause healing in your tissue and regenerate. Okay, so you have a strong, robust immune system. You will not have that as well or as efficiently, okay, because you're getting less and less DNA-based pairs because your telomere attrition is happening. So cytomegalovirus is actually associated to an uptick in cancers, to an uptick in infections, and again, a faster and accelerated aging. So, in our practice, I'll often run this test, and you can often suppress the virus by using some antivirals and using some therapies like ozone and some dietary and other immune protocols. But the key thing is to appreciate it because the one thing I do when we do biologic age testing with a true diagnostic lab test where we look at biologic age so we can tell your DNA how well you're aging or how unwell you're aging. If I see some inappropriate telomere attrition, so where somebody's maybe they're 50 but their biologic age and telomeres looks like they're 62. One of the first tests I draw is cytomegalovirus. Many other viruses too, but that's one of them. So, this is really, really, really important to appreciate. And again, there are things you can do about it, but again, test, don't guess. And when you test these things, we often get a lot of good information to help, prevent disease and slow down aging, because your pace of age and your things like telomere attrition is really, really key. So let me shift gears into another common question I get. And that is, because it's kind of in vogue, even though it's not really new, is the supplement, the product Methylene Blue. So Methylene Blue is a synthetic, man-made, like I was saying, textile or a compound. It's been developed back in the 1800s and often used antimicrobial and used as actually a dyeing agent. And what they found is that it was used to treat something called methylhemoglobinemia, a blood disorder that's very, very rare. It has to do with oxygen transport. They also used it a little bit back in the early 1900s in malaria. But what they found in this is that it was really good in redox reactions. Basically, fancy words for that, it lowered reaction oxygen species. It had a lot of like neuroprotection, immune stimulation, mitochondrial stimulation. And so there's a lot of these, researched, if you will, benefits in enhancing energy, okay, and immunity. So, there's some really good literature. I'm actually just pulling some of this up, and there's some really good science here on PubMed about it. But a lot of it is research-based, so not human clinical trials-based. So this is where I want to be a little careful, because it's really in vogue right now on TikTok and Instagram and all the stuff where they're just pumping out all these videos about everybody should be on Methylene Blue. And I want you to be careful because there might be an upside, and we do prescribe, and I will use Methylene Blue occasionally. And I personally have taken it just as a kind of a test run because it is fairly safe. And when I say fairly safe, I'm gonna give you the precursor in an oral form, because believe it or not, there are people out there injecting it and doing it intravenously, which I completely disagree with. But when you stimulate mitochondria, which with aging we all get, mitochondrial degradation and basically slowing, which is basically these little engines in your cells that are basically like pooping out. They're getting tired, okay? And any more fuel you can give it, like CoQ10, iron, vitamin E, and a few others. Methylene Blue is one of them. It actually NAD, it stimulates that mitochondria. And so, again, Methylene Blue is one of these. And sometimes we see some significant improvements in energy. That's usually what we see. I don't usually see too much objective, meaning laboratory testing, that shows any improvement. But I do, and it is a methyl donor. So when you have a methyl donor, there is some detoxification benefits, which allow some like neuroprotective benefits, okay? But here's my caveat about it. And this is the way I kind of incorporate this is, safe is around probably 10 to, at maximum, based on body weight, 50 milligrams a day. If you notice an improvement, which some people do right away, I definitely would recommend cycling it a little bit, maybe every few weeks or that. But if you don't notice much, and we don't objectively see much, I even though most studies will say, and this is the evidence here in research, is that in vitro and in animal studies, that it's exciting because there's very high protective benefits and very low potential harmful benefits in quote unquote models. I don't know if I want to be a model test. So this is where I kind of am a little bit careful with, okay? But here's the thing is that, so again, if we're not seeing objectively and you're not feeling, I would tell you to kind of halt and wait. And the reason is this. There has been some autopsies, and so cadavers and research done on brains and hearts, and these organs are getting stained. And they're depositing in the tissue of your brain and heart and organs. And they're literally like blue. I mean, they're blue dye. Actually, when you take Methylene Blue, you will actually urinate through your kidneys. You'll actually see tinge blue, and some people at high doses get it on their tongue, et cetera, and the mucosal membranes. But again, to me, that doesn't seem natural, meaning it's a man-made textile compound. I'm going to err on, listen, there's many other things we can do to improve health. It would be way lower on my scale of like what we would go to. And when we do use it, I want to see some objective laboratory improvements, and I want to see some, subjective on your part, hey, oh no, I got some energy. And it's again, after we've already done other mitochondrial stimulating benefits, okay, as well as other 6-point model benefits on all our pillars. Again, you want to address hormones, nutrition, gut health, diet, exercise, your food health, how much alcohol you're consuming, what's your sleep quality, are you moving your body, do you have structural pain that's interfering with sleep, all these other features before in my opinion, you're taking a methylene blue. So pump the brakes on that. Some literature recently, in fact, Stanford has some literature and analysis that it did show insufficient long-term human data to give a recommendation. And that's kind of where I'm leaning more towards, is this kind of limited study and data that to support it, So and another thing that I want to share with you, because a patient brought up to me, I read all this new current literature, and I brought it up in other, I believe, podcasts and other talks, but I get brought up a lot of times because people make jokes about is heavy metals, okay? And I'm not talking about like the band I just interviewed, Bush, or heavy metal music that I listen to when I working out at the gym and hitting the weights and stuff, okay? Or I'm on a mountain bike ride. Love that stuff, by the way. Because gosh, I often think, and I'm, grateful for music. So not to sidetrack here, but it's amazing stuff for the body and the mind. But back to heavy metals that we're talking about that are toxins. Okay. It sounds like, yeah, whoa, this is way out there, doc. Let me tell you, they are so prevalent in our community. And I want to read you some studies here because, these are no longer, the odd test that your practitioner might recommend, your holistic, alternative practitioner might recommend. We're seeing high levels of cadmium and nickel and mercury and arsenic and all these things over and over and over, and they're causing significant cardiovascular disease increases, significant neurocognitive and neurovascular conditions and diseases. This is something that we really need to test, not guess, test and appreciate because, pretty much it's not if you're toxic, it's how toxic, and you got to get these out of here if you want to age well. And I'm going to tell you the uptick of, cognitive decline and earlier diagnosis of dementia, higher rates of cancer that we're seeing in somebody's 40s, 50s versus 60s, 70s, and then, earlier cardiovascular disease. We're seeing these heavy metals laid down in the plaque. So in your plaque, in your intima. So, we should all worry about our hearts. Obviously with aging, it's the number one cause of death. And when you're considering, the conditions we often don't think of, again, heavy metals. Okay, so again, arsenic, cadmium, nickel, lead, mercury, et cetera. So, and this study actually, a fairly recent study, and I'm just pulling up here, was from the British Medical Journal, a meta-analysis, and the American Heart Association, and also then just a meta-analysis from 2025 of 16 studies pooled together, okay, showed the significance of all of these metals combined, especially, meaning like this bioaccumulation of these was associated with in upwards of 30% of cardiovascular plaques and events. So when they actually they looked at the studies and they looked at clots and they did surgeries or did autopsies on people that had died from cardiovascular disease, and they pulled these out, upwards of 30% of these had heavy metals in the plaques, okay? And as I read here, which is key from a combination of these studies, and again, this study is in 2025, so this is not something old, okay? But lead causes coronary heart disease, stroke, hypertension, higher risk of mortality. Cadmium, coronary artery disease, stroke, peripheral arterial disease, higher mortality. Arsenic, cancer, coronary artery disease, stroke, hypertension. Mercury, arrhythmias, cardiovascular disease. All of these things are implicated in heart events. I will tell you also, carcinogens and cancer events. So my point here is this, and I get asked this a lot, and it's so easy to do, is one, test, don't guess. Get a heavy metal test. The best way is through urine. You can get a reasonable one through hair and reasonable one through blood. Often, though, the best way is urine, provocated because the reason that what that means is it's pulling out a little bit what's circulating in the fat and in the tissue, in the sub-Q tissue and in the organs, et cetera. The point is that's more of a true value. You can do chelation. The best is IV. Also orally you can do. Also, one of the best things you can do to detoxify and get rid of any toxin but heavy metals is sweat, poop, hydrate, lose weight. The fatter you are, the more toxic you are. So remember that, okay? It's not if you're toxic, okay? It's just how toxic and what. But really appreciating and having a good heart, a good brain, less cancer risk, and aging gracefully, you don't want these environmental toxins. So again, I'm going to wrap this up. This is Dr. Lewerenz from Longevity Health Institute and the Deep Six podcast. A few questions here that I commonly get. AMA Ask Me Anything. And listen, if you have a loved one or yourself need any help, reach out to us here at Longevity Health Institute. And we're many practitioners, including myself, just love and are passionate about what we do, delivering the best of this 6-point model into diving deep into your health, reversing a disease in a personalized approach and a concierge medicine approach to help you thrive and not just survive. So you be well, and I'll see you again on the Deep Six.